Hey everyone, we are recording now and switch this over to Facebook. So give me 1 second. Okay, here we go, gang. Hello, everyone, and welcome to our Heart for PCOS panel series. Tonight, I have a superstar panel along with me who are going to help me with talking a little bit about research, about cardiovascular disease and cardiometabolic health with PCOS, and patient engagement, why it's important for patients to get involved and to speak up and to educate themselves about the risks for cardiovascular disease, diabetes, and other health consequences if we're not understanding what PCOS is and what it can do to us. So I wanted to first start off by introducing our panel and having each of them tell you just a little bit about themselves. So I'm going to start with Michelle because she's the closest one to me. Hello, Michelle. Thank you for joining this evening.
Hi, Ashley. Thank you so much for having me. I am a registered dietitian who specializes in cardiovascular disease management and prevention through science-based nutrition. And so this is a really important topic, and I'm really excited that we're explaining and really empowering individuals with PCOS to notice the connection and then feel empowered to take control of it through nutrition lifestyle.
Absolutely. And then we have Dr. Robert Wild. Hello, Dr. Wild. Thank you for joining us this evening.
Hi there. I'm a reproductive endocrinologist focused on cardiometabolic disorders and polycystic ovary syndrome. I'm a clinical lipidologist and been taking care of patients with PCOS for decades. So look forward to the discussion and encourage people to get involved.
Thank you so much. And then I have Kendall. Hello, Kendall.
Hi, Ashley. Hi, everybody. Thank you for having me. So I am a PCOS patient and a PCOS researcher, and I'm in Ontario, Canada. And my research lab really focuses on kind of the psychosocial aspects of PCOS. And we're kind of also interested in understanding how folks with PCOS kind of cope with the syndrome, how they manage the syndrome kind of on a day-to-day basis, and also the impacts of the syndrome on their quality of life.
Awesome. And then I have Dr. Fiona McCullouch. Hello, Dr. Fiona.
Hello, everybody. Thanks, Ashley. It's amazing to be here. I love this event every year, and I'm a naturopathic doctor. I practice in Toronto, Canada. I also have PCOS myself, and I really, just love sharing information and helping with awareness so that patients can prevent conditions like cardiovascular disease, because a lot of us were never told about this when we were first diagnosed.
So for my first question, I'm going to kind of do this in a round robin style and ask each of you to give me a little bit of input. But why is PCOS awareness vital, especially when we're talking about metabolic risks that go beyond reproductive years and infertility? So Dr. Wild, I'm going to start with you on this.
Why is cardiometabolic health so important with
For
PCOS?
PCOS, yeah.
Well, it's a lifetime disorder. Atherosclerosis probably begins in utero. It's an important childhood thing to pay attention to. It's a progressive disorder. It ultimately has a horizon that we see as heart attacks or strokes or congestive heart failure later. But the fact is, if you can interrupt progression, about 90% of all cardiovascular disease is preventable. And women with PCOS are at greater risk. So the sooner they can understand that trajectory and what to do about it in their daily lives, the better they are at preventing, which is what we hope people are knowledgeable about.
Absolutely. Dr. Fiona, how about you? Why is PCOS awareness vital as it relates to like cardiometabolic health, metabolic health, and going beyond reproductive years?
Yeah, I think a lot of, the message has always been like, it's a fertility condition. Once you have babies, you're kind of done, or it's gone at menopause. And so actually a large amount of patients are really unaware that it actually does have cardiovascular risk. they might really not even be thinking of that. They might not be looking out for it. And then these events can be really serious and sudden. So if there's people know and they can start having themselves checked really early, they can, can save lives.
Yeah, absolutely. Kendall, what are your thoughts?
Yeah, I mean, I completely agree. I think from a preventative standpoint, it really helps to kind of understand what those biomarkers are, to understand what they mean, and to kind of know your baseline to be able to kind of see, how those markers maybe are changing over time. And so it's being informed and being educated as a patient and working with your healthcare team or your healthcare providers, to have these really important conversations early, because prevention, like I had mentioned, is so important. Like we've all kind of talked about. And I think that raising awareness, just like these events, which are so important, are really, crucial to, educating everybody, the general public, like, everyone about PCOS and about the cardiovascular risk factors, because again, like folks mentioned already, it's sort of understudied. Like PCOS was really kind of seen as more of a fertility issue initially, and now we're having these more widespread conversations about the cardiometabolic impact. So it's incredible to see that shift.
Absolutely. Michelle, how about you? What do you think about this?
Yeah, so I echo everyone else's, input, and I want to just emphasize one important thing. Fine, with PCOS, oh, this is another risk factor. This is another risk factor. But like Dr. Wild said, it's a preventable disease if we catch it early. So I want it to be empowering. You have the ability to prevent heart disease if you have PCOS, if you have, heart disease is preventable, but we need to do it early. And we need to do it proactively. So we need to know your risk factors. We need to be engaging in those risk factors and seeing the trends of where they're going. And we need to implement science-based nutrition, medication management as necessary, stress management, sleep hygiene, physical movement. All of these things need to be implemented as a lifestyle change to really put it in remission so we don't have to worry about it. And we can live a long, healthy, and get rid of a lot of the health anxiety that comes with this diagnosis. So as much as it's scary, I really want people to take it as an empowerment approach. Without the knowledge, we can't do anything about it. So we need to be more knowledgeable and take it as, well, what can I do? Let me ask more questions. Let me be my own advocate so that I can prevent these complications from happening.
Absolutely.
Or I can wade through the healthcare system on my own behalf.
Yeah. So Dr. Wild, I have a question for you. What are we seeing shifts in research and practice with PCOS as far as there being a focus now on metabolic health, or do we still have quite a way to go with this?
Well, we always have far to go, but we've come quite a way compared to where we were. It's kind of where we were, where we are, where we need to be. It was totally ignored for a long time. It is now starting to get on the horizon. People are understanding it's much more than just a fertility issue. And because there are greater advances in all of women's health, and PCOS is a unique identifier, there's a bit of a shift. That's an important subset of women's health to pay attention to.
Yeah.
I mean, in the way of background, there's an enormous gender bias in terms of understanding cardiovascular risk, because on the average, heart attacks happen 10 years later for women and men. But now that people are seeing things like accidents of pregnancy, PCOS, all these unique factors are beginning to come to the horizon of mainstream cardiovascular science. And that's through a lot of strong advocacy in women's health in general. But the uniqueness that PCOS brings has come to the forefront because it affects so many people. And it's very unique. It's still puzzling, still challenging, but at least it's very much now respected. And it's identified. And I think that's coming a long way from where we used to be.
Yeah, it definitely is, because I know when I was first diagnosed in 1999, nobody knew what it was. And it took a couple of people that were talking on Yahoo groups. Yes, I'm dating myself with that, that we started talking about having these weird symptoms and all this weird stuff going on with our bodies. And we all collectively figured out that we had PCOS, and then we were like, oh, okay, now what do we do with it? But so there is a lot more knowledge and resources out there, but I think patients are still feeling like the medical community is not getting it. And Kendall, you've done some research on this, haven't you?
I have, yeah, in Canada. I want to go global like, and study, kind of the international experience. But yeah, I mean, we've spent, the last 4 or 5 years studying the diagnosis experiences of women with PCOS. Initially, because we wanted to understand what was going on with the leg, with the diagnosis delay. And so we spent a lot of time kind of talking about healthcare experiences, delayed diagnosis, kind of confusion around what PCOS is, kind of whether or not they're, should we call it PCOS, like polycystic ovary syndrome? Should we call it something else? Is it a misnomer? There was at one point 3 different, diagnosis criteria that different practitioners were using. There was a lot of myths and misconceptions about the syndrome, as well. So it was the data that we collected really kind of illuminated that and kind of, amplified advocacy and how important it is to advocate for your health, to engage in many different strategies to make sure that you're getting what you need out of your healthcare team. While also, educating like medical students and providers and young folks that are, coming on the scene to have these conversations about women's health and risk profiles and relative risk and comorbidities and all of these different components. And then we've learned that this experience isn't unique to Canada. It's a global issue. There's diagnosis delays across the board. Which we're trying to tackle by really connecting on forums like this and having these important conversations so that we can improve care everywhere for all folks with PCOS. And that's
the more everyone advocates, the
Mhm.
more it's known. The grassroots approach is ultimately going to well up and move the needle more than anything.
Yeah.
I think you're right. I think having a marriage between patients, practitioners, and researchers is vitally important at this point. And I think working together, we can go pretty far. But patients do need to understand that their voices do matter and their voices do impact future research and the government funding the research to help researchers
or
and
even in front of
practitioners.
your own doctor, start asking for answers.
Absolutely.
They're out there, and demand them. If you don't get what you need, go find it.
somewhere else.
It's there.
Yeah.
Absolutely. So that actually gave me a perfect segue because Dr. Fiona, I wanted to ask you, what is it that practitioners should be looking for and how can they help patients understand this condition more and understand that there are risks, but we can optimize we could optimize our health to reduce those risks?
Yeah, I think like for practitioners, the most important thing is really just to update yourself regularly because we're learning so much about PCOS, and what we know now is really different from 10 years ago. So if you have that information, you can pass it on. But if you don't know, you can always, research it for your patients if they ask. A lot of the patients really just feel dismissed. Like they'll say that over and over, that they go to their doctor and they're just kind of told to take like the pill or to, go lose weight or something like that. So if you're the type of practitioner that doesn't say that, you really stand out to patients. And, patients are wanting to learn and grow, and they're really very happy to have any provider that just wants to help them and learn whatever they need to support them, because it's a complex condition and every single person is different. So that would be my advice, is just really, connect to the patients, listen to them, support them, and just learn, because we're all learning so much about this.
Absolutely.
It
And Michelle,
also takes, from a doctor's point of view, it takes a lot of time to understand it, communicate well about it, understand the uniqueness, marshal resources, learn the resources that are around, which may be different in different healthcare settings. All those things are important. So the person and the doctor, the healthcare person in front of you may or may not have those resources, but that doesn't mean they don't exist. And that doesn't mean that you can't help connect the dots for all the components. And certainly on a national, international level, there's excellent information you need to hold of what's necessary and what's needed. I think the important solidifying concept is you really need to know targets. You need to know targets for blood pressure. You need to know targets for LDL and HDL and triglycerides and targets for waste and targets for activity and targets for heart healthy eating and targets for sleep. Once you understand that concept, and there are resources around, believe me, to go after it. So the problem is that so many healthcare systems, it's fragmented, and that pushes it back on the patient to seek it out. So
Absolutely.
I don't know about Canada, but I can tell you that's what it's like here.
Yeah, no, it definitely, there needs to be a lot more education for providers so they are able to help patients for sure. And Michelle, that's one of the things that I actually wanted to talk to you about because you're all about prevention. So why is knowing about cardiovascular risks with PCOS a big deal, and what should we know about this and be teaching ourselves and teaching our practitioners about this?
So if we don't know, then unfortunately something might happen and then we find out. And so by knowing that we can prevent it, we prevent that chance from happening. So I see a lot of it on the other end. People have a heart attack, they come to see me and they're like, I had no idea I was at risk of a heart attack. And most people don't know they're at risk of a heart attacks and strokes, and that it's preventable. 80 to 90% of heart attacks are preventable through science-based nutrition and lifestyle medicine. That's what the research shows us. And so we need to be understanding our risk and knowing, okay, what's my cholesterol level and what's my trend, right? So if you're, first off, like Dr. Wild said, the target ranges are really important. So we've been seeing in a lot more newer research that the ranges that were used to be there, we need to actually tighten them up in certain risk groups because they're too wide, they're too high in certain risk groups. So for instance, a lot of times people say, oh, LDL cholesterol. If it's above 130, then we'll medicate with a statin. But we've seen in the research, if it's above 100, if it's above 70 in a very high risk patient, that's too high. And we can do that through nutrition. And if in certain cases, medical management also needs to be coupled with science-based nutrition. But if we don't know, we can't do anything about it. And cardiovascular disease is a silent disease. You don't necessarily feel blood pressure trending up. You don't feel cholesterol high. You don't feel blood sugar levels elevated. You don't feel a lot of these symptoms and a lot of these numbers. So we need to be checking them, and we need to be more informed of how do we optimize them and make sure that they're not trending in the wrong direction.
Absolutely. So Dr. Fiona, what do we need to be looking for and aware of with PCOS patients as far as cardiovascular disease?
I think one of the earliest risk factors that, is obvious is insulin resistance, and this can start very young. And that's definitely a risk factor for cardiovascular disease. It can create chronic low-grade inflammation, which is one of the main risk factors for cardiovascular disease. And then, like others were saying, the lipids are all very important as well. High blood pressure is a really big risk factor. If that has occurred, that really adds in a lot of risk overall. Stress as well, because there's a really high incidence of mental health disorders in PCOS, depression and anxiety, and these have also been associated with cardiovascular disease, and not something we think about. Things like sleep apnea is, another risk associated with PCOS. We see a very high incidence, also associated with cardiovascular disease. There's, we have the abdominal fat deposition, visceral fat. There's, we see a lot of different risk factors, high levels of androgens, disruptions to estrogens, which can be beneficial for heart health. So, all of these things, the hormonal balance, and all of these risk factors can be looked at, and then, even more closely after menopause as well, because the risks go up even further at that point.
Absolutely. So Dr. Wild, from some of the things that you were talking about regarding prevention at earlier ages, do we know, you said that it starts in utero, but are there risks really there that young, or does it start when menstruation starts in teenage years? Is that when we should really start focusing on things?
Well, The pediatric community, for example, is improving with mandatory screening for like cholesterol, for example. It wasn't that way 10 years ago, but preventive cardiology and lipidology is now integrating that into practice. I'd say in a community where there's somebody very knowledgeable, 50% of the pediatricians check it appropriately. In situations where there isn't somebody that's that knowledgeable in that community, less so, but that doesn't mean it isn't important to do so and to understand what norms are in the pediatric population. Let's say you're an OBGYN and your first patient comes in at 21. Who takes care of that patient between ages 9 and 21? Are they lost as a pediatrician? Many pediatricians do, and they do appropriately. And then there's all this stuff about menstruation and all the stuff going on, and who's paying attention to heart disease risk back then?
Yeah.
Well, we should be. Patients should be. So does it start? Well, okay, it depends on which set of parents you pick.
Okay.
If it starts in utero. It depends if your mother has PCOS in utero. It depends if your mother had preeclampsia associated with a PCOS in utero. If she was gestationally diabetic, because we know fetal programming affects pediatric development. And our argument has always been, if you think about what happens pre-pregnancy or during pregnancy and get people to target, and you can start to break down that vicious cycle. But if you're in the middle of that and your child is there, they can be screened, or you yourself can be screened at any age. The point is if you halt the progression with appropriate management, you can do that at almost all ages. I mean, Michelle brought up a target of really low LDL post a heart attack. Well, I mean, prevention works. We have powerful drugs that can work better than surgery in most people for improving their risk for a second heart attack.
Yeah.
So wouldn't it be great just not have the heart attack at all and start thinking about that really early?
Yeah.
And learning all this stuff and
Can I-
keeping it under control
I mean,
rather
to
than
add
wait
to
till the cat's out of the bag. I mean,
Yeah.
The other thing to remember is in the organized cardiovascular world, we know much more about ages 40 or greater.
Right.
And we have risk assessment tools for men and women. We have a Framingham score in Canada, I think more widely used than ACC-AHA in the United States, or and none of the risk estimators are perfect, but they all have their strengths and weaknesses. Some better in women, some in men, some built into electronic medical records. But what that does is helps the provider or the physician say, well, if I know this person's a target, how much risk is there and how severe should I be treating them to what targets?
Absolutely. And I think Michelle actually wanted to add something in to this real quickly.
Yeah.
Go ahead, Michelle.
Yeah, I just wanted to mention how I completely agree with Dr. Weil. We want to start intervention as early as possible. We've seen in autopsies 8-year-olds have atherosclerosis in their arteries. And so we know that it's a progressive disease. It might take many years to show up, in the arteries or a blood clot, but it starts at younger age. So the earlier we intervene, the more we can prevent, but no age is too late. So, wherever you are in your journey, taking in that step of how do I empower myself to be more preventative and taking those small steps to achieve that is going to be helpful.
Absolutely.
I also, sorry.
The other thing that Michelle brought up is, okay, it's one thing to know about all that stuff. It's also another thing to know how to make it happen.
Yeah.
Because
Absolutely.
we're all habitual people. We all have lifestyles we either grew up in, or we have a partner that doesn't behave that way, or they cook differently, or we have a unique thing from our Asian Indian cuisine that's not very heart healthy, and it takes me a long time to convert all that. So
Absolutely.
the changing of making it happen is you have to be patient with yourself because change takes time, even if you have knowledge.
Oh,
So
100%.
it's more than just knowledge. It's your ability to make effective change in an environment that is conducive to making that change.
Yeah.
Absolutely.
And I think that goes into saying the importance of personalization with PCOS, because you'll hear a lot of non-research based people, influencers online talking about get rid of dairy, get rid of gluten, get rid of this, get rid of that. Well, then what am I left to eat? And that just confuses people even more. And so we want to look at it at the flip side of, well, what are we nourishing our body with? What are we doing to help lower inflammation and lower insulin resistance, optimize our lipid panel, and flip the switch of what are we adding to our diet? And I find that that's much more empowering.
So, so you're
Absolutely.
confused and you wonder, well, I want to get this stuff off. So what does starvation do to me?
Yeah, no, that's definitely something we have to talk about. And Kendall, I want to bring you in on this because what I wanted to find out is what has changed? Have things changed? Have things gotten better for patients, or what are patients looking for as far as tools and resources to help them better understand and get a grasp on PCOS?
Yeah, that's a great question. And it's, it's something that's come up in our research as well in terms of like what patients want. And so even though there are some, challenging or frustrating experiences getting a diagnosis, getting a treatment plan, and that kind of thing, there are in our data, we found some really, really great like experiences with providers. So having kind of that open, non-judgmental space to talk about your concerns, talk about different options, talk about the difference between potentially supplements and vitamins versus medications and what could work for you. So again, it's like what Michelle was saying, very patient-centered, kind of holistic approach. And they also want integrative care. They want people talking to each other, specialists working together, not operating in silos. They want to build bridges with the medical community so that they understand both the side effects and the risks, and what happens if I take birth control, for example, and then what happens when I get off of that, because you don't want to take it for your whole life. So what happens when I decide to change my medication or change my dosage or try something new because I don't like how I feel on this particular medication. And so the problem that we were finding in Canada, and I mean, sure, it's other places too, was that patients were kind of leaving the doctor's office defeated, like not really knowing what to do, not knowing about the future. There was this level of kind of uncertainty, and so because they weren't getting the answers all the time, from their medical team or medical community, they would go online, right? And they would go to websites that were perpetuating a lot of misinformation. Like there's some really good websites out there that have a lot of education, a lot of evidence-based information about PCOS, but there's also other websites that are not vetted, that don't have the most accurate information. So they were kind of getting like suspended in between. It's like I feel worse about myself in a way going on to some of these websites. I feel like I'm making all of the wrong decisions, and so there's a lot of conflicting information. But having that time and that space and that environment to have those conversations, to think about long-term impacts, to think about side effects, to think about like what I need to look for, like what are some things that I need to worry about. And we talked about how some of these symptoms are really invisible, but like, if I had access to my biomarkers and I can look at my trend, like Michelle was kind of talking about, so I can understand, okay, how have I, changed over time in terms of my LDL, in terms of my inflammation, like my CRP, in terms of these metrics that are associated with a higher risk of heart disease, then, maybe I can have more autonomy, more engagement, more kind of control over my own body, and my own.
So I often ask my patients, what are your numbers?
Yeah, no, it definitely.
And then what do you think your number should be?
Absolutely. And
then,
I actually, Kendall, I don't know if you wanted to, if you had something else that you were adding on to that as well.
Oh, I was just going to mention, I'm seeing these really cool like patient cards. So they're like little, they're almost like little keychains, and they have these little tiny cue cards that have the medication that they're currently taking, how much, what the dosage is, who prescribed it, how long they've been taking it, and then medications they've taken in the past and what those side effects were. And they bring some of that documentation with them, and they're just these little things they hold on to. Or again, asking for that documentation and that information. That was
Kendall, in Canada, how good is it? One of the things I insist in my office is I always want every previous lab and every history and physical that I can get a hold of before I ever see them. You know how hard that is to come by?
Yeah, you need
That
an
is
interview,
difficult
yeah.
for a healthcare provider.
Yeah.
I mean, I was even trying to get records for my daughter to another physician myself, and it was amazingly difficult.
Mm.
So I kind of liked it better in the military. Every patient I saw in the military, they brought their chart with them.
Mm.
Yeah. So
But
That's
it's a
great.
systems issue too. That's the point I'd like to bring up.
absolutely.
So if you're knowledgeable about where you are and where you're going,
Yeah.
you can navigate much better.
Yeah, and I think we do need to talk more about that. But before we get into that, I actually wanted to ask a question. I want to start with you, Dr. Fiona, and then let everybody kind of chime in. Can we definitively say, and I know this is a topic that you've talked about, that PCOS is actually epigenetic, or are we still kind of figuring that out?
Well, we don't 100% know. My undergraduate degree is in molecular biology and genetics, so I love geeking out on this and just reading about it. But from what I have read, basically there are some gene signals, genetic SNPs, that are now being associated genome-wide with PCOS. But a lot more research needs to be done. There's not enough yet to definitively say that these genes are clearly associated with PCOS, but one of the more recent, bigger studies found that there were different ones between the insulin resistant type and what they called the reproductive type, which is really the non-insulin resistant type. So they found that, but then they also do know that epigenetics have a huge impact on this. So that the intrauterine environment, those changes are epigenetic and can last for a lifetime, can be transmitted to future generations, things that happen, during childhood, even, to the brain, but, and at puberty, our environment, what we eat, our stressors, the toxins we're exposed to, all of these, they can induce PCOS in animals by exposing pregnant animals to bisphenol A and cause PCOS in multiple generations from that point. But we don't know exactly how it all ties in together in humans, because that's not ethical to run trials like that in humans. But we know both of those factors, genetics and epigenetics, which is the effect of the environment on the function of our genes, those two things influence PCOS.
Sorry.
Dr. Wild, I would love you to also talk about this a little bit.
Well, I mean, I think, she kind of hit the nail on the head. It's a heterogeneous disorder. Not every PCOS is the same. People are looking for commonality. There are better and better techniques genetically. There's Mendelian randomization, there's environmental studies there. But some of it is really early in terms of heart disease in relation to polycystic ovary syndrome. Some of them are done with designs that are like that moment in time, rather than finding how things change over time longitudinally. So we're kind of early on applying a lot of neat techniques to answer the question. And we're behind the 8 ball in PCO compared to some other disorders in cardiology, for instance. So, yeah, I mean, if you look at what Fiona mentioned, there are common genetic risk factors for types, but it's a complicated issue because of heterogeneity involved, and we have a lot farther to go. I think she summarized it nicely.
Absolutely. So, Michelle, wanted to talk to you a little bit more about, because we were just talking about epigenetics, but what happens over time with patients with PCOS? They start to experience some metabolic complications, and there are a lot of myths about things like insulin resistance and what foods we can eat. So let's bust some of those myths and talk about things that we can do to improve our health to kind of lower some of these risks.
Definitely. I mean, insulin resistance is found in 70% of people with PCOS. But a lot of times, people associate, well, okay, my body can't process these carbohydrates as efficiently as someone else, then I'm just going to get rid of them. And we look at getting rid of a full macronutrient, you're actually going to become very vitamin deficient, and you're going to take away a lot of really important components that are found in complex carbohydrates that help to lower cardiovascular disease risk. So for instance, if you take away the carbohydrates that are found in whole grains, legumes, beans, vegetables, you're getting rid of a lot of vitamins and minerals and fiber, which helps to bind cholesterol and excrete it when you have a bowel movement. So we don't ever want to get rid of a macronutrient. A, it's not sustainable, but B, it actually can lead to nutrient deficiencies, which can impact all organs of your body. And it's really not good for your overall health. It's really not good for your cardiometabolic health. So we're really focusing on a nutrient sufficient diet that has the right macronutrients and micronutrients for your body to optimally absorb it. This doesn't mean we want to get rid of carbs. We want to have a carb control diet that's well balanced, that allows our body to control our blood sugar levels, our lipids, our triglycerides, and reduce inflammation as well. So important not to get rid of carbohydrates, but know how to add them into your diet in a way that your body can utilize it appropriately.
So Michelle, rather than talking in complex terms as a nutritionist, give us some pointers as a naive person about nutrition. In other words, what kind of foods can I eat? What kind of foods can I not eat? What are complex, what aren't? What do you mean by simple sugars? What help us expand a little more?
Sure. So the easiest way to look at it is simple sugars is like your candy, your juice, your foods that strip away the fiber and expose more sugar. Your body has a hard time absorbing the blood sugar and putting it into the cell, so it can spike your blood sugar levels. When you have fiber intact with it, like your vegetables, your whole grains, your whole wheat bread, your beans, your legumes, it has carbohydrates, but it's attached with fiber that has a steady release of blood sugar. So your body is able to absorb it better and more efficiently because you're giving it more time. That doesn't mean you want to have 2 cups, you want to have excessive amounts of these foods, but when you pair it with lean protein, you pair it with a heart healthy fat in the right way, you're allowing your body to digest it better. So your simple carbs are stripped from that fiber, and your complex carb have more fiber in it. So I don't know if that helps explain kind of that example that I was talking about.
Well, but if I read a label on something in the grocery store, how do I know I'm going to get what you're telling me I need?
Right. So we can do a whole session on that. So I'm happy to do that. But you want to looking at your label. So working with and getting support is important to dive deeper into these things. But it really depends the purpose of that food. What part of the meal is it, right? When I look at a marinara sauce, it's going to be different than if I look at a bag of chips. I'm looking at 2 different uses of those foods. So what I'm looking at is going to be a little bit different in terms of my criteria. For instance, with our marinara sauce, I'm looking at the sodium. I'm looking for added sugars. That's more of what I'm focusing on. If I'm looking at, I don't know, a bag of chips, am I having adequate fiber? What am I pairing the chips with? There's a lot that goes into kind of that matching of it. So it's not so easy to be like, you need to look for this many grams of carbs, this much sodium, this much. It's more of, well, what does it look like in the complete form?
Absolutely. So Kendall, I want to shift this a little bit, and I wanted to ask you, what are we missing? What is it that you feel we need to be paying more attention to help improve patient and provider relations and patient care?
Yeah, I mean, that's an awesome question. Like, in terms of healthcare, one of the things that I've noticed, in our research is when you start to kind of dive in, like to the non-biomedical aspects of PCOS, so the social science data, for example, like the lived experiences of folks with PCOS, how they navigate the healthcare system. A lot of it is really kind of doom and gloom. It's quite negative. It's like, delayed diagnosis, frustrating experiences, burnout, like just defeated, those kinds of things, right? And so I think that we need to kind of focus on patient-provider communications, patient-provider interactions. We need to focus on building connections and building community among patients and providers. We need to have more of these types of panels and more of these conversations where patients and providers are kind of together, working together, because we're all coming from different lenses, right? So it's like when I think about the biomedical lens and you put on that lens and you kind of see things in that frame of reference, and then the patient has their own kind of unique experiences. And when we come together and we have those conversations, then we improve patient care. And so we need more of the patient voice, the patient experience. We need to understand the diversity of experiences as well, intersectionality, like all of those different parts with respect to PCOS. Some of our work, focuses on intersections in terms of like age, in terms of age of diagnosis, in terms of gender, in terms of ethnicity, in terms of ability status, socioeconomic status. So kind of getting a deeper understanding of the lived experiences from, diverse folks, and focusing on the positive sides of the story, like the experiences that have been, like turning points in people's lives. And that's some of the data we're collecting. We're sort of like trying to reframe PCOS in terms of like healing and recovery and thriving and flourishing with a healthcare team that is behind you and that is supportive, and focusing on holistic and integrative care, which is sometimes easier said than done, I think, but it's getting everybody in the room together and having these crucial conversations. And with PCOS being 1 in 10, right, in some countries 1 in 5, I mean, it's incredibly important. I mean, this affects millions upon millions of people. In Canada, the most recent estimates that we have is 1.4 million, but I know it's more than that because many folks go misdiagnosed. And that gets into the point that everybody's talking about around prevention, right? If you don't have a diagnosis, you don't quite know what you're supposed to do. I mean, it took me 5 years and 2 countries to get a diagnosis. So, but there was that sense of relief of like, okay, it's like, now I know what I have. Now I know that it's PCOS, but like, oh, now I know it's PCOS. Like,
Yeah.
like, so, I think it's finding ways to build community and build, healing and recovery and flourishing and all of those, infusing kind of, some of those positive experiences into the mix, and bringing in patient experiences and moving from, again, the biomedical part is so important. Like there's advances coming out all the time with respect to biomedicine and treatments and innovations and those kinds of things. But at the end of the day, like we're all humans and this is a condition that affects my life every single day. So my voice, needs to be part of those conversations.
Absolutely. Fiona, what are your thoughts on that?
Yeah, so that I really love that because I the more I think about it, the more I think that PCOS, it really shouldn't be pathologized. It's a condition, really. It gives you susceptibilities to having certain conditions at different times in your life or certain problems that you need support for. And I think it would be really efficient if they had clinics that really treated patients with PCOS or offered those services in a single area, where they had like dietitians and doctors, cardiologists, reproductive consultants, and endocrinologists, just everything there with everybody who could coordinate care. But a lot of it is really just needing support. We just want to know what's coming next. What should I expect? Like, where can I go to get this kind of support, or, join a patient group to talk to other patients? And maybe it's, it's not something they need even a treatment for at that time, but like just to know that there's support with providers that really understand this condition and then can provide guidance every step of the way through life.
Absolutely. So we're starting to run low on time. So I wanted to go around and do another kind of red robin here. And Dr. Wild, what changes do we still need to make to advance recognition of PCOS and to ensure that we're reducing risks for things like cardiovascular disease and optimizing health for patients?
I mean, in the profession in general, or? Well,
Yeah.
I mean, the major funding organization for the United States research is the National Institutes of Health. The largest, most well-funded organization is the NHLBI, National Heart, Lung, and Blood Institute. We need to get that recognized within NHLBI as an important target, because prevention is becoming increasingly important in cardiovascular medicine. But until those funding organizations move it beyond the NICHD, which is Childhood Risk and Development, which is a smaller institute more related to reproduction, moving it into that arena is really going to help, because the downstream effects of all that are going to improve, because it's the major funding organization.
Absolutely.
That is going to be a monumental thing to happen. But until that happens, nipping at it from up, grassroots up, is truly beginning to change. It's changing how health insurance reimburses expensive medicines to keep people targeted. It's really improving access to care. It's improving patient-centered types of care models, where you can aggregate all these things together, because it's not always available everywhere. So it's not only the big money for funded investigators, but it's involvement of the healthcare system at every level, and patients pushing that I think demanded. Eventually, people realize there's a public health system, and then there's a big NIH Institute-driven research agenda, and we need to make it visible and knowledgeable in both those arenas.
Yeah, and it is starting to change a little bit. PCOS Challenge has done some groundbreaking work in this area, because I guess it was 2 years ago now, I was on a panel with them with the NIH, and we actually talked about PCOS across the lifespan. And that's why it is, as you were saying, important that we, as patients, use our voices, and we don't say, oh, you know, that one's advocated for a while, I'm going to let her do it. We all have to speak up and let Congress know that this is important to us. And that's one of the things that I just
Congress pays the bill for the NIH.
Yes, they do. So I just wanted to put it out there, gang, that coming up in March is PCOS Challenge has their PCOS Advocacy Day, which is an annual campaign. This is the one time, if we're talking about grassroots, that you can do your part and raise your voice and tell our legislators, look, I'm not getting enough care. People don't understand it when I go and see them. And, you know, I've been to 12 doctors over 5 years. They still haven't given me answers. This is your chance to tell the people that fund the research this, and that it needs to change. So like, I expect to see all 50 states represented, because it's important. And don't think that you don't matter. I started out just sharing my story online, and 25 years later, here I am sitting with all these wonderful people talking about change for PCOS. So everybody can do it. You just have to get up and be strong enough to share that story and that voice. And I'm sorry, Michelle, I had to just get that out real fast, but I would love to hear your input.
Yeah, no, I mean, it's really about, like you mentioned, advocacy and raising awareness and making, you know, like we've said before, a lot of times PCOS is only attributed to infertility, and we don't go beyond that. And we really need to have the conversation early and really create awareness, and then give the importance of the support and the empowerment that comes along with it to get those numbers optimized, to make sure that we're in control of PCOS and not the other way around. So we need to do more advocacy, but we also need to be an advocate for ourselves in all aspects of it.
Absolutely. And Kendall, I know you have been one of those strong voices that continually supports PCOS Challenge and patient advocacy and the patient voice. So I would love your input on this.
So, I mean, I totally agree. Like, I want to echo what everybody's saying. I think we need to, you know, individual advocacy, collective advocacy, like coming together, banding together, to improve like our quality of care and service delivery. And it has to come from the bottom up, right? Like, it's not coming from the top down, right? It has to be grassroots. These movements like PCOS Challenge is like bringing together, you know, so many people who all have this major goal. And we're all doing it in a way where we're building community, and that's the beauty of it all. And I think, when I was thinking about like, just more stuff that we need, like with respect to PCOS, I think, one of the things that I want to continue to fight for is more care in terms of mental health and mental health support, in terms of self-compassion and self-acceptance, and, just again, it goes back to kind of the other side of the story, so I'm going to continue to kind of fight for, also both the physiological stuff and the physical health, but also mental health and psychosocial supports. And I want to know what support systems look like, and what supports are most effective for folks with PCOS. And this is an awesome way to start that that conversation.
Absolutely. And Fiona, I know you've been pounding the pavement with me almost as long as I have, so I would love your input as well.
Well, first I want to say thank you, because I remember meeting you like a long time ago and being like, wow, this is Ashley. Like, oh my gosh, you were like all over Twitter and Facebook and just relentless, and like still the same, have not stopped.
Never give up.
Never give up.
Yeah. So yeah, and I just feel the same. Like, I feel like I've seen it come so far since those days where, nobody really even knew what it was, and everybody would go to events and everybody just felt so alone. And now like there's this huge community and people know so much more about it. So I love seeing that grow, and I really love like the grassroots, and I love, how we're all kind of making it happen. And then hopefully, the research will start to move into a better category, and we'll get more funding, and even more will be known in the future. So I think the future looks really bright.
I think so too. And there you have it, guys, from like some of the experts here that are telling you, don't be afraid. Use the tool that you have, which again is your voice. And that's part of the reason why I also do Heart for PCOS. Yes, we're talking about cardiovascular disease and optimizing health for PCOS patients, but at the heart of it, the heart of it is the PCOS patients and this community coming together to make change happen, to support these wonderful practitioners, researchers, coaches who are trying to change perceptions about the condition we live with. So we have to help them help us, gang. And, I would love to see as many people as possible joining in this movement, wearing your red throughout February, attending these live events, these live panels, and absolutely following every single one of these people, which I will make sure that you have information to connect with them. If you want to join their practice, you want to chat with them, you want to learn more about what they do, I will make sure that you have all of those resources. And to my wonderful panel who joined me tonight, I could sit here and talk to you guys for days about everything. And I wanted to thank each and every one of you for taking time out of your schedules to make this a priority, and to help patients and to, again, change perceptions. So thank you to each and every one of you.
Well, thank you for sharing, everybody. It's been great.
Absolutely. And gang, be sure to check the calendar, because there is either an interview or a live stream almost every night through the month of February. Get educated, get empowered, get yourself over to register for PCOS Advocacy Day, and I will be seeing all of you soon. Thank you, as always, for hanging out and joining us. Good night, everyone. We're good. Thank you so much, everybody. There's just so much that we could say about this, and I was trying to give everybody an opportunity, but each of you are just so amazing within your own right that it's hard. And I hope that at some point I can have each of you back again to do something else, because you're all wonderful. So thank you.
Well, I'm sure we could give a lot